once again that this will be Governor Spanberger signing legislation, specifically House Bill 229 and Senate Bill 173, which prohibit carrying weapons into hospitals and other healthcare facilities that provide mental health or developmental care. According to the U.S. Occupational Safety and Health Administration, healthcare workers are 4 to 5 times more likely to experience workplace violence than other working Americans. That's in the press release from Governor Spanberger's team. And now we go live out to Sentara, where Phil Hernandez is actually speaking right now, a representative from Norfolk's 94th District. So Delegate Phil Hernandez at the podium. Let's listen in.
You all do it every day. And I want to say this could not have been possible without a team, an incredible set of advocates working toward this. So I wanted to call it again Anna James, Andy Stevenson, Keenan Caldwell is on vacation, I understand it, but you can tell him I said nice things about him. And I really wanted to call out Dr. Burgess. Will you just please stand up for a moment, Dr. Burgess? If the attire didn't give it away, she's a trauma surgeon, and she showed up like that in the General Assembly. And, you know, when people show up in the Capitol wearing scrubs or the white coats, it's a little bit unusual. People tend to notice that. And she was the perfect messenger for it, because she has literally operated on people who have suffered wounds from gun violence. Who better to make the case for a law like the one the governor has signed than someone who knows what it is to save a life? Shouldn't she and all of you feel safe when you're doing that life-saving work? Yes. Yes. The answer is yes. It's not a trick question. So, like I said, this was the third time we've tried this bill. What was the difference? Why did it work this time? Did we make clever arguments? Did we have better statistics and facts on our side? Maybe. But you know what also changed? 2 words. Her Excellency. So with that, I am very honored to introduce the Governor of Virginia, Governor Abigail Spanberger.
Thank you. Thank you for the kind introduction, Delegate Hernandez. It is so great to be here with all of you. And I want to say thank you to Delegate Hernandez, to Senator Williams-Graves. Thank you for listening to the communities that you serve, the people that you serve, and recognizing that there are things that you can do in the legislature. The reason that you go to Richmond is to fix things and to solve problems and to address the concerns and needs of the communities that you represent. And so thank you to the Sentara team for recognizing a problem, recognizing something that needed fixing, and for working to ensure that it isn't just the incredible patrons who carried this bill year after year, but that their colleagues who voted for this bill, who passed this bill, recognize the importance not just here, but across our Commonwealth. And as a former federal law enforcement officer, I certainly understand the importance of keeping our communities safe from gun violence, particularly in the places where we are most vulnerable, in schools, places of worships, and yes, in hospitals. And we know that 6 years ago, right here, a gun was accidentally discharged in an inpatient room. Fortunately, no one was hurt, but it raises a question that I think about, that I know a lot of Virginians think about. Where can we feel safe? Where can we go and know that the threat of gun violence has been addressed? Where can we walk through the doors and focus on healing or on loved ones in a bed in front of us without that fear in the back of our minds? And a hospital should be that place. It should be that place for the patients, for their families, and importantly, for the healthcare providers who day in and day out are doing the work of caring for our loved ones. Because whether you are recovering from surgery, visiting a family member, or the one delivering care, we all deserve to be safe in these buildings. And hospitals that provide mental health And developmental services especially must be places of care and stability, never fear. We know that gun violence affects countless Virginia families. And even accidentally, tragedy can strike in an instant and change lives forever. So successfully addressing it demands a sustained and deliberate effort, closing large gaps and small ones, because both cost lives. It's worth mentioning these bills are two of the more than 100 bills that I signed this year that had taken a couple years to get a signature, previously vetoed. But the peace of mind that patients and families and the providers and staff members across our hospitals deserve, it shouldn't wait that long. On issue after issue, gun safety, healthcare affordability, protecting Virginia's families, we are moving our Commonwealth forward. And so I am proud every single day to be the governor or be a governor who says yes to very common sense, community-based, focused, well thought out, thorough legislation that impacts people's lives and keeps our community safe. And I am grateful to Senator Williams-Graves and Delegate Hernandez for their persistence in getting this bill done. Their work made today possible. And to all of the advocates and to all who lent their voice to the importance of this bill and other bills passed through the General Assembly, that would be 1,122 for anyone who's counting. It is because of that work and advocacy that I am signing SB 173 and HB 229, two bills that prohibit firearms and other dangerous weapons in hospitals and facilities that provide mental health and developmental services, protecting patients, staff, and families in our most sensitive care settings. And with that, I would love for you all to come up and join me for the signing.
Hello. How are you? Good to see you.
Good to see you.
And so if there's an advocate you want to give it to, Mr. Brian, give it to them. Okay.
I go behind. Yeah. I hide everybody, so you come to some stand myself.
I am a puppy. You can come over here.
I wanted to.
Hello, ma'am. Oh, yeah, where's Dr. Burgess?
Yeah, I want Dr. Burgess.
Yeah. Yeah.
Right here.
Yes, right here. Absolutely.
You guys come in the front here. We'll get some nurses at the front, some white coats. All right.
Good job, Andy.
All right, ready?
All right, I'm going to be starting with SB 173, patroned by Senator Angela Williams-Graves.
It's been a long time coming.
Yeah.
Excellent. Thank you. Thank you.
And this is HB 229. This bill would make it a Class 1 misdemeanor to knowingly and intentionally possess certain weapons in a healthcare facility that provides mental health services, patroned by Delegate Phil Hernandez.
That's me.
Ladies and gentlemen, that concludes our ceremony for the afternoon. Please enjoy some refreshments in the back.
All right, so the conclusion of that event, those two pieces of legislation being signed to prevent firearms in hospitals and other healthcare facilities. Now, we heard one of those, two of Norfolk's representatives were responsible for those bills. We had Delegate Hernandez and Senator Graves. I want to do a little bit of background on Angela Graves, who really has been involved with Norfolk communities for as long as you can think. Born in Norfolk, Virginia, went to Booker T. Washington High School, Tidewater Community College, Old Dominion University, was a part of the Norfolk City Council, was vice mayor, a member of the House, and now a member of the Virginia Senate. Angela Graves has been involved in Norfolk politics and Hampton Roads politics for some time, and now we get to see a piece of legislation that she was largely responsible for signed into law by Governor Abigail Spanberger.